Welcome to this week's episode of Surgeon Interrupted. Today, we are so privileged to have Mohini Dasari joining me today. She is a general surgeon and writer with her first book coming out shortly, right at the opening of 2026. We cannot wait to hear all about it. But what's incredible about Mo and her career is not only the surgeon writer identity, but also everything that it took for her to get here. She has famously shared her process of leaving a surgical fellowship. We're honored to have her here in the studio with us today to share that story again in her own words.
Yay. Thanks for having me, Francis. I'm really happy to be here and chatting with you. And honestly, the community you've created is just amazing. And 2 years ago, when I was leaving fellowship, which I'm sure we'll get into more, I would have loved to just, seen your story or people talking more about stuff like this, which I think you sharing has really helped with in the community. So thanks for everything you do too.
Thank you. Yes,
Yeah.
that's so kind and I really appreciate it. I actually do show up, I feel like every day, especially online. My sole purpose for doing it is to try to help like the younger me. Before we even go back to more of the beginning, I just want to reiterate what I love about what you've shown through your writing and sharing your story is just this idea that we've tried our best to hide this from the public, from ourselves for years, but physicians are people. Surgeons are people.
Yeah.
And I do find that a lot of the trouble that we're experiencing in healthcare is even resultant from like a refusal to accept or look at that directly.
Totally. Yeah. And even, I think there's two parts of it. There's, patients maybe don't really want to see doctors being too vulnerable or human or whatever. But I've just putting that aside, I've actually just been amazed more so about like when you show your human or vulnerable side, like how colleagues often feel very uncomfortable, or there's a lot of people who seem to appreciate it, but there's a lot of people who are like, what are you doing? Why are you showing anything but like a solid exterior? And especially in surgery.
Yeah, and exactly. And it's tough because you feel like then if you show any of yourself, people might weaponize it against you. That can be really scary. But then at the same time, it's funny because I feel like in a world where like physician suicide is a very real phenomenon, it's a huge issue. It's sad to see the rhetoric when physician suicides occur. The rhetoric is, that's weird. Why didn't you just like tell everybody and ask for help? And then
Yeah.
yet we see how people are treated when they do ask for help. And so
Yeah.
to me, the way that we change this ASAP is to continue to like put light on it and also like destigmatize any shame around it. So again,
Yeah.
thank you. I'm so excited to jump into it, but I'm also very here for any time that a couple reasonable, thoughtful, articulate people show up and dive into something like this. I do believe that that moves the needle on destigmatizing it.
I agree with you. Yeah. Just even, saying like I'm struggling or I have struggled, it doesn't feels crazy. Like every single human should be able to say that statement, but, you know, in certain professions it's harder to do that. So.
Yeah, exactly. I can still remember the first time that an attending who I really admired, who was so impressive and the person that I wanted to be when I grew up, when
Yeah.
they shared that they struggled. I feel like that like broke open something in me or like
Mhm.
healed me.
Yeah.
So can you take us back just a bit to the beginning of your process of really becoming a surgeon? What drew you to it? What kept you in it?
Yeah.
And what your life pre-fellowship was like? I think that's helpful to know, like, what was your old ordinary world?
Yeah, sure. Um I never planned to be a surgeon. I, wanted to be a doctor since I was like 17 and I was going to do, peds or OBGYN. I wanted to do a lot of like global health work and those were the areas I was thinking I would do that through. Honestly, it was just a very transformational experience I had when I was in MS3. I was on this rotation. I just clicked really well with the intern, with the whole team. I was on a vascular surgery rotation. And I think it was just one of those times where it's just the people that you're with can really change your
Mhm.
life and the trajectory of your life. And they were all like, you seem to have a knack for this, not just the OR, obviously, it was just an MS3, but just, the surgical way of thinking or just of, going through patient care. And I think it just awakened something in me. I was like, oh, maybe I should keep an open mind. And I actually do really like this environment and the pacing. And so then I went through the rest of my third year kind of with an open mind, but I won't lie, like that influenced me a lot. When people tell you like, hey, you're good at something, you seem like you'd fit in here. It was appealing. And I think that's kind of what moved the needle. So I went through all my other rotations and I just never felt the same way about another specialty. And so Um,
May I
then there's
ask,
yeah.
did anybody else on other rotations, like, just anecdotally, like, did anyone comment to you? Did anyone say, "Hey, you have a real knack for this, like, we loved having you on this service," or
That's a great question. I mean, I think internal medicine was good, but the funny thing was I went from surgery to IM to OBGYN, and then I was kind of like holding out and waiting for OB-GYN to see if I would like it as much as I liked surgery. And somehow, like my friends who I was rotating with and stuff, they were already like, "Oh, Mo's going to do surgery." And so like they kept telling everybody. And so I feel like on the rotations, everyone was like, "Oh, like you're going to be a surgeon." So this, that, the other. And so it was almost like the identity was already like shaping upon me, even though I wasn't completely decided yet. And I have thought about this a lot, obviously, like the way things have gone over the last few years. And I've wondered, is there a lot of like sort of external forces that shape me to make this decision? And I'm almost embarrassed to say yes, but I think it's true. I'd like to think that I'm just very like internally motivated and that external, what people think about me and what people say to me don't affect me. But like, that's clearly not the truth. There were a lot of factors that sort of shaped the decision.
and
So
I
to
love
answer
that.
yeah, I mean, I don't know. It felt good at the time. I was like, okay, yeah, I'm going to do surgery, and
It
uh,
does feel good, and most
yeah,
medical students are, like, kind of still children. I mean, it makes
right.
perfect sense, and I
Right.
can relate to that. I
Yeah.
feel like people were telling me, "Oh, you would be great at this, like, really hard thing. We think you could do it, this
Yeah.
hard and cool thing," and I was
Yeah.
like, "Wow, say no more."
Right. Yeah, were you planning to do ENT or surgery or
It was the same thing in that I just happened to end up in an ENT office for my gap year, and
Mm.
the people, I really thought that it was a match and, like,
Yeah.
that, "Oh, this is a group of people that I really get on with, that's a profession that I respect, but
Right.
it was happenstance that I ended up there, and then further, to me, a story that I'm reminded of as a medical student is that I loved every single thing I rotated on, and that's why I always go back to that quote of, like, "If you can see yourself doing anything else, don't become a
Yeah.
surgeon," because
Yeah,
I
yeah,
was
yeah.
not that person. I
Yeah.
worked another job during medical school. I loved every rotation as a 3rd year, and I felt actually like I could envision a version of me on each of those teams.
And I think what I would also add, just kind of reminiscing back,
Mhm.
one of the other things that I felt like I had some sort of duty to like show, like, oh, like not only am I a woman, but and there were other women interested in surgery, but also just like as a minority too. I was like, I want to do this thing because it just when I look around at like, like you look in all the hallways and you look at a lot of attendings at major places and there's a lot of men and it's changing a lot. But I think part of me also felt like I want to like show myself I can do this and I want to like show other people I can do this. And I was pretty involved in our Association of Women Surgeons chapter. I started it at my med school. And so I kind
That's
of was like
awesome.
building all this energy to be like surgery should be diverse. It can be diverse. And I think I just like kind of it all snowballed, So the decision kind of just midway through 3rd year, I was like, yeah, I'm just doing this.
Yeah, you were sold. I mean, and it was
Yeah.
being reinforced even externally.
Yeah.
I just wanna call out because I think the other amazing thing, like, I love AWS, that's awesome that you started a chapter, but I just wanna highlight that it feels like already at this point in your life and career, identity is merging a bit
Yeah.
with profession. So, like,
Oh
okay,
yeah.
we've decided surgeon, and I think that, right, like, I'm already
Yeah.
seeing some of that merge happen, and so I'm
Yeah.
excited to see how that plays out, but yeah, continue.
It's exciting, and then I will say 2 years ago that, when your identity merges so much with your profession, then it can also really crash and burn hard, which I've been learning the last 2 years. So, yeah, no, I think I was very much like, "All right, we're gonna do this, and it's gonna be great," and I was super, like, gung ho as a med student about surgery and just about everything, and, I came out here I'm in Washington State. I went to residency in Seattle. Residency was residency, it was hard, and there were definitely I think I started to lose myself in residency a lot, as a lot of people do, but just in terms of physical health, mental health, there was a lot of suppressing because that's what we do. And so I loved transplant as an R2, and that was, I mean, I just never found another specialty that I loved as much, in terms of what we were doing for patients, the actual operations, just even like the rounding, the medicine, like I just loved it. And then when people told me, like, oh, it's really hard, and even people were like, it's really hard to like, have a family, have relationships. And I wasn't even sure I wanted kids at that point, but it's almost like every time people said that, I was like, no, then I have to do it because I really want to do it. So you saying that, like, it almost makes me want to do it more because I don't think that that should be a reason not to do something. But yeah.
I love that as well. I appreciate you sharing it so openly. I 100% identify with that. I've met many other surgeons specifically who have that little bit of like, if you tell me that something would be hard to do, or maybe that I can't even do it,
Yeah.
well, I wasn't gonna do it, but now I'm for sure gonna do it. Now I'll drop whatever I was working on and like I have to do it. And
Yeah.
I don't know, like, how would you characterize that? I just almost there's got to be one good word for it.
I would say pathologic, but
It's pathologic something, yeah.
something,
Y-
I don't know. I mean, I don't know what it is. I think it's partially like the types of people who like go into surgery. It's just very goal
Yeah, it
driven.
self-selects.
Right. Right. But I also think some of it is part of that, like, I mean, I was also pretty involved in women's surgery groups and stuff in residency and like try to build that support and community. And so part of it also felt sort of like, if I really do love this thing and if I really do want to do this thing, then I feel like it's also my responsibility to like show that I can do it, not in like a egotistic way, but just in a way of like, we need to change the culture so that we can do these hard specialties and they're not just restricted to certain groups of people just because it's hard to exist in these spaces.
One quote that I've always loved is that, like, if you don't have upper management that looks like your young talent, you're going to lose your young
Mm,
talent. And I think
mm,
that that's very true. That's
that's a
something that
great
you're
point.
combating. Okay, so we're sold on surgery, like the identity, even further during residency, because I do agree. I think a lot of even the way that like residency is set up, and maybe parts of it are inevitable. I would argue parts aren't, but like it's so easy to lose yourself during that
Hmm.
time. And guess what? There's like another identity waiting in the wings that's like, oh, I'll be your full, complete persona. You
Hmm.
can just be a surgeon now, and you don't have to be any of that other stuff that you don't have time for.
Right. Right. Yeah. I mean, like in undergrad, which is when I started writing the first draft of this book that's coming out in January, that has nothing to do with medicine or surgery. It's just purely other parts of my life. Like in med school, I had less time to write. I still wrote a little bit, but like, by the time residency came around, I wasn't one of those people who was able to do my hobbies. Like I just lost it, and I
I don't
think,
know any surgeons who really kept up with hobbies during
yeah,
surgery.
I don't know. And I think to me, I was like, oh, it's a hobby. That's something you do for fun. But yeah, you lose more than that, I think, when you don't do things that are, like, good for your soul and, like, good for your overall well-being, and it sounds so obvious, but I don't think I really realized how much that affected me until, honestly, the last 2 years when I've been able to build it back into my life. Then I realized, "Oh, this is why I was so unwell," amongst other
Mhm.
reasons.
At the end of residency, again, you mentioned like during training, it was pretty clear, like you felt a pull towards transplant specifically, right? And so you
Yeah.
chose that fellowship route. And can you tell us like about that fellowship? Is that a couple years?
Yeah, it's a 2-year fellowship, it's like abdominal transplants, liver, kidney, pancreas is, like, a small portion of it, and I decided, like, our 2-year that I would be interested. Our 3-year, I was, like, totally committed to it, and
Mhm.
and then I interviewed when I was in R4, and I actually interviewed I was, like, pregnant, but I hadn't had my daughter yet, but, that was some people, mentors and people were like, "Oh, transplant's gonna be hard as a mom," but also a couple of people I talked to some transplant surgeons at different institutions who were like, "Oh, I'm a mom and it's possible and this and that." So I think that just gave me like the checkbox I needed to be like, "Okay, great. I'm going to do it. Whatever. There's people who've done it." But that actually ended up being one of the major reasons I left during the fellowship was just for me personally, like family stuff came up that was just not I didn't have the support I needed, and the culture of the fellowship and everything was just that combined with like being a mom and other stuff, it was just too
Mhm.
much. So, but I come back to that a lot just because I think the advice we give people, is so important and we don't always do a good job being honest. And I just wonder of all these people that I talk to beforehand who are like, yeah, it's possible. It's like, okay, what does possible mean? Does that mean that you're falling apart and it's possible or like you're healthy and thriving and it's possible? I was falling apart and so it was possible, but it was really not.
Wow. Yeah,
Yeah.
absolutely. Thank you for sharing that insight. And I totally agree with what you are touching upon here. The definitions, I mean, obviously, I know hundreds of female surgeons, and they define possible and reasonable and healthy differently. It's
Yeah.
heterogeneous. I
Yeah.
would say, even if the majority of us define it one way, there are people where what's reasonable or possible or healthy still does not involve seeing their kids much at all, if ever, but still
Right.
happy as a clam. And I appreciate that because we're all such different people. But I agree with you that the advice that the old guard gives, especially students and trainees, I
Mhm.
do think it's so important. They tend to sugarcoat it,
Mhm.
and that just does a disservice to everyone.
Yes, for sure. And then when I ultimately ended up leaving fellowship, there was some talk of like, well, why did she choose it? Why did she knew what she was getting into, all this stuff. And I mean, it's a complex issue. And I think if I had to be honest and like defend myself who chose to go into transplant, I
Mhm.
just feel like the advice I got was very different from the reality I faced about what it was going to be like, not just as a mom who's a surgeon, but just honestly going into this field. And like, it was a little bit of that thing where, before you enter a certain specialty or a certain group, like everybody's really like encouraging and nice and positive about it. And then you enter and everything switches, like someone turns the lights out and they're like, all right, now fend for yourself, and
Yeah, now it's like Saw 5, the
yeah,
the
yeah.
hospital. Yeah. No, it's
I
a
can't even,
catfish. Yeah.
honestly, yeah, I don't know. So yeah.
Think that yeah, there's so many like universal themes in what you're talking about. So again, I appreciate you sharing it. I think this is so useful to everyone because I even noticed my experience as a medical student. I was treated honestly very well. And it didn't hit the same and nothing ever felt personal. And also people were actively trying to get medical students to like want to go into this field. So
Totally,
I
totally.
do feel like that worked on me.
Yeah,
And then
yeah.
the resident experience is so different from that, and same thing where I can
Mhm.
totally imagine I didn't do a fellowship, but exactly, like, they're trying to encourage people to go into this, but then, like, once you're in, it is it can be night and day.
Mhm.
The other thing that I think always this keeps me up at night sometimes is that rhetoric of like, well, why did you go into it if you don't want this? Like I received a lot of
Mhm.
that criticism when I left my attending job, which is
Yeah.
like, you picked this, so you can't say you don't like this job. Guess what? When I picked it and I was in my early 20s, again, God love that girl, but she was a child, a
Yeah.
pretty sheltered, naive child. And I had no idea of what the job would actually really
Yeah.
entail. And I
Yeah.
really didn't know what the job would entail until I wasn't attending. And the reason for that, going back to some of this questionable advice that we get, is that
Yeah.
my whole last decade, everyone told me it will be better and it will be more than worth it when you are an attending. That
Yes.
is not always good advice. Certainly wasn't true for me.
I think it's pretty terrible advice because I think the closer I got to the end, and especially when I was a fellow, I finally like someone took, it's the opposite of rose colored glasses. I had like the other glasses taken off. I could see my attendings, like they were human, they were struggling, it wasn't like this promised land, like they're like gods on earth. Like, no, like that, it's nothing automatically changes when you're done with training. Actually, like, there's a lot of things that get harder. I mean, I think that's a fallacy that is perpetuated a lot, it's all going to be better when you're attending.
Yeah, and it just
Yeah.
exactly, but I think that it can cause harm.
Yeah.
And
Yeah.
that disillusionment that you're describing, 100% I experienced it because it's weird, but I do think that every physician kind of goes through that. Because like at
Yeah.
some point when we are younger and we're in training, like I mean, I put every single attending on a pedestal. I put every single senior resident on a pedestal.
Yeah.
I was like, I love you.
Yeah.
I'll follow you
Yeah.
around. I'll follow you into the bathroom. That happens to so many of us. Like, I'm happy to
Yeah.
be here. I
Yeah.
love everything you do. I'm trying to be a sponge. For me, it was maybe mid residency, maybe mid to late. Yeah, where you're just kind of like, it's the same realization of like, your parents are human almost.
Yeah.
Like, you think that your parents have it 100% figured out. Same with attendings. Like, attendings are gods. And then
Mhm.
one day you're like, oh, you're a miserable sod.
Yeah. Yep. Or that's why you act the way you do. And I'll have to say that it was actually one of the things that encouraged me to leave fellowship when I was like weighing my decision, which took me a few months to get to that point. I left at 7 months into the 2-year thing.
Mhm.
And one of it was just looking at attendings and being like, "Oh, I don't think that after 2 years I'm magically going to be like everything's going to be fine because I can see that that's not really the case."
May I ask, in terms of like your internal process and your timeline, when do you think that you first started to have that feeling of, okay, I'm questioning if I want to stay, I'm going to consider what it would mean to leave? What was the timeline like between that thought and then leaving at 7 months?
So I started August 1st, and then it was sometime in, I would say, early December, probably 4 months in that the first month I was kinda riding a high. I was like, "Oh my god, I'm a fellow, and, like, I get to do all these things," and we had residents, and I love teaching, and I was, like, riding that high and, like, whatever, it was hard, but, yeah, 4 months in, I was kinda like, "Okay, this isn't cute anymore." Like, I'm pretty miserable, and also my husband had some health issues that cropped up that year, and that was starting to, like, become active, and so it was kind of also just we have an infant, and my husband's having these issues, and he needs surgery, and all this stuff was happening, and, um, I didn't have really community or understanding in the fellowship, and a lot of that honestly is just because everybody is spread thin, the attendings, everybody, there was just nobody could support anyone, hardly could support themselves. So I was really like, okay, this is not working. And
That's
then between that and actually leaving, it was about 2.5, 3 months more. So,
Oh my gosh. Well, as I said, I'm sorry that your husband dealt with those health issues that year. I will say every doctor I know who made a change in their career, and I mean, I'll put air quotes, big change in
mm,
their career. I'm not trying to
yeah,
define that really strictly, but I'm saying like the people who either changed their like model of practice or maybe even some I've heard of people changing specialties or of course there's just leaving clinical. Maybe like rolling back hours.
yeah,
One common theme that I do personally see is reminder of mortality, whether it is their own personally or a spouse or otherwise immediate family member. But honestly, I find in my own anecdotal experience, it is like oneself or their immediate partner. And that
yeah.
tends to wake people up or galvanize them enough to do something that is really hard that maybe they otherwise like would not have done because of the activation energy required to do
Mhm.
it. Is that
Yeah.
fair?
Totally. And I think to our earlier point, we were talking about, okay, doctors, surgeons are humans. It's like how much you suppress your humanity. Well, at a certain point, yeah, you can't ignore, like, okay, someone might die, or like I might die, or, something really disastrous is about to happen or has happened. Yeah, there's certain like warning signs you can't ignore, but it's amazing to me how far I let myself go down that road before I was like, I got to put the brakes on this or leave this, and looking back, I mean, I wouldn't call it a regret, I guess, but like I would have pulled the brakes a lot sooner now knowing what I know. But it's just
No.
sad to me because I think a lot of people suffer a lot more than they should, and I'm not advocating for everybody to leave training and stuff like that, but just, like change, like you're saying, whatever shape or form, change to like be healthier and be safer, like that should happen, you know?
Yes, absolutely. And I'm with you because honestly, I mean, as I am a reasonable person who's a member of society, I am here for, I want there to be doctors. I want there to
Mhm,
be more and better and more well doctors. That's
mhm,
something that we should all, I think, want
mhm,
for our civilization. I love what you're talking about with change though, because like for me, sure, if I could go back and I could change some things earlier on and make smaller changes, that would even be change the way that you relate to your work.
mhm,
Change the way that you build your identity or don't around a profession. Like those are changes that yeah, exactly. I'm not ever advocating for a mass exodus from like a very meaningful important profession. But yeah, I think that changing those things, changing your expectations from your job, like all of this stuff because surgery does self-select for this type of personality that only knows how to go and grind and work. I mean, of course, there are systems that take advantage of that.
mhm,
I think that it is sad because most people don't really seriously feel enough impetus to get off the conveyor belt or change which conveyor belt they're on until there's this reminder that our time on earth is limited. And
yeah,
when I personally got that wake up call, I was like, "Oh, I got to get out of here." And like
yeah,
probably sooner rather than later. I mean, I had initial plans to be in attending for 10 years,
yeah.
not just 3. And then it became 3 years is good. 3 years is still me overstaying the amount of time I want to be in here by like 5 years.
No, for sure. And I think you being open about all of that, it's honestly even helped me. I'm still practicing clinically, but just, seeing people like you share your story, I'm still reevaluating like my relationship with my work, and I'm actually between jobs right now. And, I think I'm just grateful though that I'm like actually asking myself those questions and doing those check-ins now because I don't know that I would have gotten to that point had I not come to that point where I had to leave fellowship. I think I would have just kind of kept trudging along, and I think a lot of people do that, and you could do it for a whole career, and that's fine, but I'm glad I didn't.
Exactly. Yeah. Or they're a little bit older than us and they end up hospitalized. I hear stories like that all the
Mhm.
time. I mean, you compensate until you don't.
Yeah.
That's just something that I used to tell my patients all the time, like in my laryngology clinic. And now I tell myself that when I'm trying to like really bring old maladaptive behaviors and thoughts and approaches to work into my current life.
Yeah.
I just have to chastise myself. We say, no, we don't do that anymore. Like, push the system to its limits. I guess that my question would be, do you feel like you would do surgery again specifically? like general surgery? Because people, of course, ask me all the time, like, okay, well, let's say, I think it's an interesting thought experiment. If you and I were both in medical school again, and maybe like, let's make ourselves M2s.
Mhm.
So the world is your oyster.
Yeah.
What do you think you pick?
I've asked myself this question like dozens of times, obviously, and I've changed my answer recently because honestly, up until a few months ago, I'd be like, of course I wouldn't. I would never do this. Like, why? Like, why would I? Even though I like being a surgeon, I still like being a surgeon. I like the clinical care and stuff, but just residency and the whole fellowship thing. It was traumatic. It was hard. And I just don't want to I don't want to think about having to do that again. But my answer now would be I think I would still do it because I was the person I was then, and I
Hmm.
had the influences I had at that time. I had the desire, I had the motivation. Like I chose it for a reason and I have to like respect that younger version of myself choosing what she thought was right for herself and what she cared about. And I even transplant, like, I would like to say, like, no, I wouldn't choose it again, but again, that's me now, and I'm so different now than
Hmm.
I was in the middle of residency, so I don't know. But a different way to answer that question, I also sometimes think, like, maybe I would have not done medicine. I think
Yeah.
life is just there's so many variables, it's kind of hard to know.
But I think that you have a beautiful perspective on it. I love that. Philosophically, I love this idea that we just like have grace for our younger selves who absolutely were like trying their best at the time, right?
Right.
I've gotten like a spate of hate online and just people being like, "So you took up somebody's spot in medical school and in residency. What,
Yeah,
like, just I did that to sow chaos? Like, I did that because I had no other plans for myself in my 20s?" I can assure you, I could have been doing other more fun things in my 20s. It was not like it was never from sinister intent that like a
of course.
physician might want to pivot when they are older. I, at 34, could not be more different from, like, my 24-year-old self.
Right. Yeah, I resonate with that, yeah. How would 24-year-old you know what you're gonna be like at 34? You can't. You can only know what you're at that time, and you were following your heart, or I was following my heart, at that time. So I don't know. But I think that goes back to the thing about, like, giving people more honest advice.
Yes.
And again, maybe that wouldn't have changed anything, but I just think, like, honesty that's kinda why when I left fellowship, I was like, "I'm gonna write about this. I'm gonna talk about this because I just feel like honesty counts for something. I think that's, like, a large part of what you do too, right? Just being honest about your reasons and your process.
Yes. I even met with, one of my old college friends is also an ENT, and we were talking, and we both were like, "Did we get off track here?" And we just both had shared, like, as general ENT attendings, it was very different from what we thought it would be like, and honestly, like, call being a big part of that, but not only just call, but also, like, what the unrelenting, like, being a surgeon, it is serious work, it's super important work. We're both very thoughtful, sensitive people, so it
Mhm,
kind of also means being bought into worrying about your post-op patients
mhm.
every day, maybe for eternity, which I'm not knocking that, but I'm saying there are probably certain personalities better suited to it than
Right.
mine. And I just think that what I was warned about, like when I was making that decision at the time, everyone said residency is going to be horrible.
Mhm.
And so at first I didn't want to do medicine at all. I was like, "Oh, when I'm in my 20s, I don't feel like I want to get beat up in residency." But like
Right.
actually, again, I came around, I really thought about it. I was like, "Okay, I can do that. I could do anything for 3 to 5 years."
Yeah.
So I was in on residency, but no, I don't feel like I had a realistic any idea. I didn't, and I own parts of that which are that I did not maybe think through or really look critically at some things. But
Yeah.
again, just a kid. So I mean, I was like, this
Yep.
this is great, and I think that I have a skill set for it. And so I was not critically looking at the attending adult life. And to your point, right? Like I don't think that they're sharing some of the trials and tribulations of that work with like a young kid who's maybe looking at shadowing or going into this. But what I think is huge, and again, I know that you're like still figuring out then your next era, your next chapter, what that's going to look like. I think that if I could just even say one thing for all of us, for my own benefit as well, for you, for any person in medicine who even just like has questions about like, well, what are the many eras of my life and career going to look like?
Yeah.
I think being aware of and not accepting all of like the shame surrounding it. Cause shame
Mm.
can and will kill you. and has tried to kill me. To me, that's part of the core thing. And like, if I had to distill it down, I'd be like, shame. That's what I'm pushing back on. So this
Yes.
idea that a physician who wants to do something even slightly different from what they're doing, or maybe massively different from what they're doing, I do not accept that that should be a shameful thing. People might try to attach shame to that for us. We can't control other people. So that's fine. But in my own house and internally, I have had to really like manage and get to a spot where I believe this is not shameful. This is literally normalized in other industries. It's normalized for other intelligent people. Their careers are a jungle gym, not a ladder. I see so many examples of it everywhere, and I'm trying to bring that
Yep.
here. So does that resonate at all? And you mentioned, yeah, shame has also tried to kill you. It will.
It will. It's so self-destructive and, yeah, and honestly, yes, it resonates. I mean, 2 things that come to mind are so one, I'm very pregnant right now. I'm like 8 months pregnant, and I
Congratulations.
Thank you. And it's so interesting because this whole time it's kind of been like a case study to me. Like I was a 4th-year resident last time and like this time, right? And this time I went down a couple months ago to a part-time schedule, like a reduced clinical schedule, and I felt shame. I was like, this is like privileged, like whatever, all this stuff, but I'm also just like this feels good. Like I'm glad I have the privilege to be able to do this and I'm taking care of myself a lot better than I did last time. And yeah, that shame or whatever of like, oh, I should be doing X, Y, or Z, or like, oh, I'm like slacking off, or whatever the voices are, it's so nice when you tune that out because then I just pay attention to how I'm feeling and I'm like, I feel a lot healthier this time. I don't feel like I'm like walking on a tightrope and about to fall off.
I
And
love that for you.
um thank you. So that was one thing that came to mind. Just like the idea of like actually like tuning it all out, like you're saying, and just listening to how you feel physically and mentally when you're making these decisions and letting that be your guiding force rather than what you think is expected of you or what you should be able to do.
Have the voices like abated?
I mean, to be honest with you, they come and go. Like
Yeah.
I won't even say that I've completely successfully like disregarded what people think or what I think I should be like. So yeah, it's a work in progress, honestly. And the other piece, I guess, to that would be like the whole writing thing, which I've re-entered and like reincorporated into my life over the last couple of years. I feel sometimes like I kind of joke with family and friends, like, oh, I'm just going through my like third life crisis. But even that idea that, you can do something else, it's okay. I feel like I still have to convince myself it's okay for me. Like when I see people like you, I'm like, yeah, you go girl, like do it. But I still judge myself differently. And so I'm trying to not do that, and be like, it's okay to be pluripotent. It's okay to explore other careers and paths. And like you said, in other industries, it's very common. I mean, my husband's not in medicine and he's telling me all the time, people change jobs, people do this, people go do startups. Like so why do we have to be so rigid? We don't, but
Exactly. We
yeah.
don't. And we're
Yeah.
not having it anymore. I
Right.
don't accept that rhetoric. I think
Yes.
that it is kind of a lose-lose if we just
Mhm.
let people kind of continue perpetuating that. And yeah, I love your honesty. I would say that for me, same thing. Cause like even when I share my journey and yeah, I've been very deeply entrenched in business for the past 6 months and not every day is like magically perfect. But here's what I do think is worth noting. Number one, if you had asked me a year, certainly 2, certainly 4 years ago, I would have been like, I am just destined to be a miserable person. I
Mhm.
am just kind of an ornery, miserable person. And
Yeah.
like, yeah, I have been kind of for as long as I can remember, certainly my whole adult life. But guess what? I'm 6 months out of the hospital. I am actually learning that I can be quite joyful at times. Joy is an accessible emotion to me. It did not used to be. So
Yeah.
that kind of reinforces it's sad what many of us, myself included, will relegate ourselves to. I was like, yeah, that's crazy. Like the fates just, they assigned me such a melancholy that the world has never seen. And like, nope,
Right.
and that's not to say that I never feel melancholy, but now new access to joy, I think is worth noting.
Yeah.
And then the other thing, when you mention voices that, right, like chirp us, or if they try to bring in shame or be like, you could be doing more. I think it's The Untethered Soul where Michael Singer talks about what if you had a roommate who lived with you and just chirped you all the time? And they just were like, you could be doing more. You're not doing enough.
Mhm.
uh, I think that you're a loser because you didn't win this award. You didn't get this promotion, so I don't respect you anymore. Literally, we would all just punch that person in the face, right? But
Yeah.
this is the crazy roommate that lives in our brains sometimes. So it's just like, how much validity and space do you get? It's fine to just be like, oh, that's my crazy roommate. Don't
Yeah.
listen to him. He's
Yeah.
nuts. He spouts off like crazy stuff all the time.
Yeah. No, I love that. That's super helpful way to think about it. And yeah, some of it is just like we, surgery attracts people who are very, I mean, honestly, just like hard on themselves, very goal directed, but to a point where sometimes it's self destructive. But it's also just the culture of like training and all these things, which is like suppress, 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 do, focus, focus. One of the other really toxic things that I've reflected about a lot is, I mean, it sounds benign, but it's like patients come first. Everything's for patients, and like to the degree at which it's like sacrifice your own health and your wellness and like everything else, I think that is another thing where I'm like, just because I want to step back a little or do something different doesn't mean I don't care about people. I mean, that's ridiculous to pit those things against each other. Um,
And exactly. And I always remind people like the doctors who are suppressing and not doing well and just showing up to those patient encounters, they're not getting away with it. Patients increasingly, even in my attending practice, when they were like recounting other office visits and interactions and things like that, they were like, my doctor was mean. They seemed miserable. Like, are
Mhm.
doctors okay? And, I'd be like, haha, like, yeah, hopefully, like, but
Right.
just no comment. But I'm just
Yeah.
saying, I think increasingly we're seeing like that breakdown. Like patients are not dumb.
Hmm.
They can see it if an abjectly
Yeah.
miserable person is sitting in front of them, no matter how much like you compensate till you don't. So I agree, we all suppress as long as we can, but this is also why we're seeing cracks start to form in a patient
Totally.
facing way.
Yeah. Definitely. Yeah.
Well, okay. I'm I have really loved like chewing on this with you because I think so important and we have lived through, this club that I do think is going to like continue to grow.
Hmm.
Um I would love to hear more about your book, which you mentioned you started writing many, many years ago, but it's coming out. It'll
Yeah.
be
For
January.
Christmas. Yeah. That's right. Yeah. Yeah.
Well, I mean, did you have like a completed manuscript from back in the day that you like dug back into, or what was that process like?
Yeah, 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 thanks for asking. It's, I did this thing called, I guess it's defunct now, but it's called NaNoWriMo, which is National Novel Writing Month. I did this challenge with a friend in college. I was 20, and I wrote this story. I grew up, like, learning Indian classical dance, and I went to school in India for a couple years in 8th and ninth grade, and so it's a story about, a young woman who's adopted from India, and she has these recurring visions of a woman who's a dancer in her head, and kind of guiding her throughout her childhood. And then when she turns 18, she decides to go to India to find her birth parents. And then she learns more about dance and ends up discovering who this woman is who's appeared to her whole life. So yeah, it's a coming of age story, and it's a lot about like heritage and family and dance and culture and just things that were really important to me growing up, and honestly still are. I feel like I just didn't access that part of myself for whatever the last 15 years. So coming back to it now. And so, yeah, I
Oh,
had a
that's
manuscript that
amazing.
I had written in college, and then, after I quit fellowship and started this other job that I've been at, I've had a schedule where I've just had more time to kind of revisit things. And I talked to my husband about it. He'd read it. He was like my first
Mhm.
whatever alpha reader, and I was like, I want to put this out in the world, and I'm very excited.
That's amazing. Okay, I cannot wait. This sounds very, very beautiful, and I would just imagine like was healing to dig back into.
Just the process over the last year of like, editing it and learning more about the publishing world and all this stuff has just gotten me more excited about writing as another part of my life that I want to spend more time doing. And so I always thought medicine was my job, and then like hobbies are like extra treats on the side. But like I've learned that, there's actually, I think the word hobby sometimes, to me at least, feels like it does a bit of a disservice because like writing is a huge part of my life, actually.
I almost think that passion is a better term for it than hobby because hobby is like such this bad word. It's like the bad H word because for high achievers, I think that hobby is how you are wasting time when you aren't studying.
That's a really good way of putting it. Honestly, I think that's probably why I've like struggled to embrace the idea of like, oh, I want to revisit these parts of myself that mattered to me a lot because they were just hobbies, but it's more than that.
I do feel like now, in terms of even how I talk to myself internally, like, yes, I think some things are passions, and I also think some things are skills. So when I clock another 100 hours writing, working on something, I'm like, oh, I'm building a skill.
Mhm. Yeah. Yeah, that's a good point too.
The other thing that I think is so important, and you are an incredible example of, is like, this is a coming of age fiction novel. And I think that for doctors, all of us are so happy to fall into old, comfortable spaces. And here's what I mean by that. When I was leaving clinical work, I was looking at what are jobs that are available to us, and medical writing was one of them. And that's not to say that there's anything wrong with medical writing, but there's also an entire beautiful world of writing. And I just personally never had an interest in medical writing or institutional or academic or journal writing. I threw myself into the literary side of things.
I totally agree. And it almost feels sometimes when you're contemplating changes outside of what you've been trained to do, you think like, oh, I only have these skills. But that's why I love what you said about skills, because it's like you actually have broad skills that can be applied to a lot of different things. And it just requires some imagination and some creativity in how you view yourself. And I think that's been like something I've been learning a lot and trying to lean into.
Yes. And you know what? Like we just met today, so I don't intimately know your skill set, but I would actually vouch for both of us. And I would say something that I feel very good about our capacity for is being a sponge. Because
Mhm.
guess what? You don't make it to surgery attending. I mean, you don't really even make it to residency, right? Without being like a prolific sponge. So that skill that they really honed into us, like in medical school level, which is be a person who can pick up things fast, who can show up and build new skill sets and adapt to dynamic environments every year of medical school, every year of residency training, it changes.
Right.
You get
Yeah.
good at junior call and now you're in senior call pool. So best wishes. I'm
Yep.
just saying that in and of itself is such a gift. And I think if we regard it as a gift and take it into like any other industry, it really does have a return.
Yeah. I agree with that. Yeah.
Okay. And then please share with us, how can we find and support your book in January? And what day
Yeah.
does it come out?
It comes out January 13th. On my social media page, I have, links to pre-orders. And then, yeah, just
Okay.
it'll be available online, and in bookstores, and excited to share it.
Incredible. Yep. We'll link that in the show notes at the bottom. And do you have any final parting words of wisdom for us today?
Well, I was just going to say, honestly, just thank you for all the community and the space that you've created for, physicians to share their stories. And I don't know about wisdom, but I think people being honest with each other and with themselves is really, that's what's helped me heal. And I think just like being honest with yourself and even with other people can help yourself and others more than you know. Like me sharing my journey of leaving fellowship, I've had people reach out to me and, not to say that I'm happy that they're struggling or contemplating leaving and stuff, but you just never know like what sharing is going to do to change someone else's life. And I think you're a really great example of that too. But I think just perpetuating the honesty and the openness is really powerful. So
I love that. That's beautiful. Thank you so much. Thank you so, so much for being here. I think that you're a beacon for all of us too. We're all in this together. And I feel like it healed something in me to learn where you've been at with your healing journey and everything. If you enjoyed this episode, please subscribe, rate, and leave us a review. Thank you so much for listening, and we'll see you next week on Surgeon Interrupted.